Hey everyone, welcome back to the channel. If you're new here, my name is Desmond, and today we're going to discuss a very important topic in medicine, opioid agonists. You've probably heard about opioids in the news, but how exactly do they work in our bodies? Why are they used and why are they so important in pain management? Let's break it down in a way that's easy to understand and more interesting. So first things first, what exactly are opioid agonists? Opioid agonists are medications that mimic the effect of opioids, like morphine or heroin, but they are used safely under medical supervision to manage severe pain. They're called agonists because they activate the opioid receptors in your brain and body, kind of like a key fitting into a lock. When opioids bind to these receptors, they block pain signals and they also trigger a feeling of euphoria or relaxation. That's why they're so effective for pain relief, but also why they can be misused. All right, let's talk about how these medications work. When you're in pain, your body sends signals to your brain. Opioid agonists like morphine, fentanyl, or oxycodone enter your bloodstream and bind to opioid receptors in the brain and spinal cord. This action blocks those pain signals and also causes the release of endorphins, which are the body's natural feel-good chemicals. So, in simple terms, these medications stop your body from feeling pain and make you feel relaxed or euphoric. This is why they're so effective for managing chronic pain or pain after surgeries, but it's also why they can be dangerous when misused. There are several types of opioid agonists out there, each used for different kinds of pain. Let's go over some of the most common ones. Morphine, a strong painkiller used for severe pain like post-surgery or cancer pain. Oxycodone, often prescribed for moderate to severe pain and is found in medications like Percocet. Hydrocodone, a pain medication that's often combined with acetaminophen and prescribed for pain after injury or surgery. Fentanyl, a very potent opioid used for severe pain, usually in the form of patches or injections. Each of these works in the same way, by activating those opioid receptors to block pain. However, they vary in strength and duration of effect. Fentanyl, for example, is much stronger than morphine and is typically used for more severe pain. Now, just like any medication, opioid agonists can come with some side effects. They're great for pain relief, but they can also cause some unwanted effects, especially if they're used too much. Let's go over some common side effects. Drowsiness. Because they depress the central nervous system, they can make you feel sleepy. Constipation. Opioids can slow down your digestive system, leading to constipation. Respiratory depression. This is one of the most serious side effects. It can slow down your breathing and even be life-threatening, especially at high doses. Euphoria and addiction. These medications can create a sense of pleasure, which leads to misuse or addiction in some individuals. That's why doctors are really careful when prescribing opioid agonists. They typically try to use them for short-term pain and explore other methods for managing pain in the long term. Let's make this interactive. Have you or someone you know been prescribed an opioid for pain? What was the experience like? Drop a comment below. I'd love to hear your thoughts and experiences. Now, let's talk about the risks of misuse. The reason opioid agonists are such a big deal is because they can be abused. People may take them in ways they weren't prescribed, like taking more than the recommended dose or using them without a prescription. Because they can cause feelings of euphoria, some people may misuse opioids, which can lead to tolerance, where you need more of the drug to feel the same effect, and dependence, where your body gets used to the drug and needs it to function. The end result can be addiction, which is why healthcare providers are really careful about prescribing opioids. To use opioid agonists safely, there are a few key things to keep in mind. Always take them exactly as prescribed by your doctor. Never share your prescription with anyone else. If you ever feel like you're developing a dependency or feel uncomfortable with the medication, talk to your doctor right away. Use the lowest possible dose for the shortest amount of time. These steps are so important for preventing misuse and keeping you safe while you're managing pain. So here are the key takeaways from today's video. Opioid agonists are powerful medications used to treat severe pain. They work by activating opioid receptors to block pain and produce feelings of euphoria. Common examples include morphine, oxycodone, and fentanyl. They come with serious side effects, like respiratory depression and addiction. Use them safely by following your doctor's instructions and talking to them if you have concerns. Thanks so much for watching. I hope this gave you a clearer understanding of opioid agonists and how they work in pain management. If you found this video helpful, don't forget to like, subscribe, and hit the bell icon so you never miss a new video. And if you have any questions or experiences to share, drop them in the comments below. Stay safe, and I'll see you next time.